Good evening, good afternoon, everyone. Welcome to our today's panel discussions on maternal and child health students. It's a work career path. We have a total of 5 panelists that's going to take us through career paths in maternal and child health. Because of the limited time that we have, we're going to start with presentations. Each panelist will have 15 minutes to present, and then after which we will move to the question and answer sessions. So I would also like to remind you all that this is our monthly seminar that we host every month, and we'll also invite you to join us in our subsequent seminars. On this note, I'm going to pass it to Sandra, and which to introduce herself and then talk to us about the career path she wants inviting us to explore, and move it on to Amanda, Honor, Kamala, and then end with Jilor Rahim. So over to you, Sandra.
Thank you. Good evening, everyone. I am Sandra Batiste. I am honored to be here. It's been a long time. I do have some slides, so I'm going to share my screen, and hopefully I can provide some information that you will find valuable. I will say that the federal government, it's big. So my experience is just that. It is mine. And it probably is limited. I've been with the federal government now for 8 years, almost 8 years. So I titled this presentation, "Oh, the Places You Will Go," which is a play off of the Dr. Seuss book, because I think if you've ever read that book, it talks about challenges you may encounter on your journey to success. And I believe that I have a little bit to share. So what I will say is that I was asked to talk about just kind of my journey. And I will tell you, I went to college without a public health motivated mind at all. I was kind of stuck. I studied biology, and I was wondering if I should become a physician or a teacher. I was torn down the middle. But I had a friend who took an intro to public health class at one of the nearby colleges. And every time she took this class, oh my goodness, she talked my head off because she was so passionate about it and she had such a good time. So she was like, "You need to take this class." So my senior year, an opportunity presented itself. I needed the credits. So I signed up for the course, and it changed my life so much so that I studied for the GRE, applied to school, left in May, and was in Birmingham and Denman Hall come August. So with that, with my time at UAB, which was a great time for me, I took, it was a global health course. It was under the umbrella of global health. And I think it was Dr. Ahiri, who was at another university. But at the end of the class, you pretty much have written a grant application. And I realized then that I really like program management. I like coming up with an idea, creating an intervention or some type of solution, testing it, seeing if it works, tweaking it, going back. I just like the start to finish process. And that was what I was going to focus on. I decided I was going to go back home to DC, work for the health department, take over, run the health department, save the world. That was my mindset. Got home. Yeah. And I didn't have a position in public health. I think I started applying for work maybe the February before I graduated. And because I'm kind of a planner, I took what I called my safety job. So I taught summer school. And by October of that year, I interviewed with the DC Department of Health and got an offer December. So it was some time, but I was happy to be in the MCH field. I worked in the Perinatal and Infant Health Bureau, which was a subsequent component of their community health. I worked with newborn screening. I did education with families, worked on boards, just a whole bunch of stuff. Had a really good time. I call it my baptism through fire. And then I transitioned to the federal government. While I did enjoy the DC government, I learned quickly that I didn't think that was like my forever place. So the federal government was what well, it was a natural progression. And when I got the opportunity, it just so happened that I worked on the program that I was the coordinator of for the DC Department of Health. So I literally switched sides to the table. So instead of responding to the grant, I now was the person writing the guidance for the grant. Now, this page, you guys, I'm telling you now, this is very high level because there's nothing super simple about the federal government, but there are classifications of positions. In the public health series is the GS0685. When you look at this series, there are two main positions that come up: public health analyst and public health advisor. I also have links because there's just a lot of information. I thought it would be better if you could go through it on your own. So the public health analyst is usually someone that is conducting some programmatic work at, let me move some of the pictures. If you look, it says work related to the planning, development, organization, administration, evaluation, and delivery of public health programs. Remember, I said I loved program management. That alone, every time I hear that, I get excited because that's what I like to do. I like to see it from the beginning to the end, and also just really use the information from the field. So I am a public health analyst. There's also the position of a public health advisor, which is more, they take on more programs, more so like a department, and they advise the leadership on those programs, the direction they should go. The data analyst, I pulled this from the CDC's website. Ironically, I put data analyst, but this also shows up as a public health analyst. So if you are interested in working like for the CDC, some of that is really managing and evaluating the public health programs. But I only put the data analyst here because if you search through USA Jobs, it may very well say public health analyst. When it comes to positions at the federal government, you can have a state or local assignment where you are in maybe a state Department of Health or a county Department of Health, and your office, you're stationed there, you're under the cooperative agreement understanding. You're there for a program or specific duties. The other option is a regional assignment. So the government has split the country and the territories up into different regions. The DC region is probably one that has a lot of federal government positions, but you're not assigned to a local government. You probably are assigned to several states and or territories, advising and overseeing multiple programs. Now, I only included these because if you look at the public health series, there are a lot of other positions that you can find at the Department of Health and Human Services, but they are not considered public health positions. I'm not going to go through these. I just highlighted them because I know that some students couple their public health education with other disciplines and areas of interest. So if some of these kind of stick out to you, then I would encourage you to even look through these. One of the links that I do have, it's pretty exhaustive, but it has all of the groups so that you can really, I didn't want to like query out what I thought people would be interested in. So I apologize in advance. If you use the link, it's a lot to come through, but you can see that you can probably still be at the Health and Human Services impacting public health, but it's not considered a public health series position. Those are the rest. Other position titles that come up, maybe a data health scientist, medical officer, management analyst, social science analyst, policy analyst, statistician. These are all folks still within public health, but they're just not considered a part of that public health series. If you were to ask me what I have learned or what I have gained, I will tell you that the federal government, it does give you an opportunity to explore your interests. You can be assigned to a program. Let's say I'm assigned to a newborn program, but I have an interest in health equity. There are opportunities to work on special projects or work groups and other things to really tweak or expose you to those other projects that you really have passion for. The federal government, when I started, my manager at the time said, "Oh, give yourself a year for the learning curve." And I was like, "I don't need a year." Okay, almost 8 years in. Oh my goodness, I feel like I've learned something, but I feel like there's so much more that I still don't know. So things are always changing, especially when you are using the field to implement the legislation that guides the programs and the policies. So I don't get bored. The work is not robotic. I told you I was torn. Do I want to be a doctor? Do I want to be a teacher? Public health affords me all of that. And the work is not robotic. I don't do the same thing every day. Yes, I'm making sure money is spent. I'm looking at how states are achieving their goals and objectives. I'm looking at data, but I'm also writing the guidance for grants 2 years out because we see what the field is saying. So it's not robotic. If you are someone that can't do the same thing every day, well, consider it because it's not the same every day. And I do have a good work-life balance. When I left Birmingham, I wasn't married, I didn't have children, but now that I do, I I feel great knowing that I'm not pressured to always show up. They're very supportive and they understand that life will life, and sometimes you need to take things, personal matters. I'm sorry for I'm trying to move the pictures out of the way. Sorry, guys. Um, the other thing about the federal government, I say apply, apply, apply. I think I applied, I don't know, a bunch of times before I actually got a chance to interview. I know someone now who's at the CDC and she's in a team lead position, but I found out that she applied to 40 something positions prior to getting that position. This is not to discourage you in any way, but it is the nature of the federal government. So if you don't apply or if you apply and you don't, make it or you don't get an interview, I say apply again. I will tell you that even when the federal government is moving fast, it is still slow. Um, and a no is not always a denial. One thing I will tell you is that sometimes you may not be referred for an interview, but your name did make the certification list. It takes probably a good year to get an announcement published. So a lot of times people pull from existing announcements. And if you made that list, they can always say, "Do you know anyone on the cert? I can pull the name and interview them." So even if you don't get the interview for the position, it's still equally as important, or it's a good thing if you make the cert or that certification list. As it relates to HR, and I learned this the hard way, as long as the position is still open, you can ask them questions about your eligibility or do I qualify for this? Do I qualify for that? As long as the position is open, they will help you. And informational interviews, let's say you do get a federal position and now you're interested in another position. They're really good about you meeting with the manager and just having an informational interview just so you can find out more information. You can find out what the day-to-day is and if that is something you are interested in. Lastly, now this is just me, give yourself grace. It takes time. So, as much as you can have a plan in mind, sometimes the way changes or the journey changes. I do believe that UAB prepared you for this, so you don't have anything to worry about. And for me, just because I'm kind of one of those people that I try to see everything from all angles. I think sometimes we're so focused on learning what our niche is. Like, what is that thing? I want to do this. This is my area. I find it as equally important to know the things you do not like. That has served me well in my career, and it has probably saved me some time. So if you have an experience and you're like, you know what, I really don't like that, I think that's good. I think it's worth it for you to take a self inventory of those things because it'll help you. And when you do find that position or that career, you will be more fulfilled and not just doing it because it's in public health. I believe that is the end of my slides. I will probably, actually, Julie already has this, so I don't mind it being shared. But there are links about the public health series, what that looks like, the qualifications, the different grades, the levels that you come in. It has more information about some of the CDC positions, and then that exhaustive resource about all of the positions, because maybe you're interested in a position that's not in the public health series, but it still is in the big framework of public health or the or HHS. If you need to contact me, feel free to contact me. I am really resourceful in that if you have a question and I don't have the answer, I will find the answer. But I am here to be used as a resource. And if you want to know more, just say so, and I will be more than happy to help you. Thank you for this opportunity. I do believe I am passing it over to Amanda. So thank you so much.
And
Amanda.
Sandra, I will ask one particular question that got put in the chat box.
Oh, yes.
You talked about exclusions. Do these exclusions mean that they're not eligible for public health loan forgiveness?
Oh, no. So those exclusions are specific to how the federal government pretty much catalogs their positions. So there are positions that are considered public health positions. Those exclusions aren't considered public health positions, not necessarily the loan forgiveness. They're just not considered public health positions. However, there are a bunch of them in public health. The federal government just doesn't categorize them as public health positions. As for loan repayment, now that is something that your HR can probably tell you way more about, but I haven't, I think that they are eligible. I haven't come across some folks in those positions where the loans have not been eligible for forgiveness.
Okay, thank you. And I'll take this opportunity to let everyone know that we do have a Q&A session built into the schedule at the end. So certainly, if you've got a burning question and want to make sure it gets, out of your brain and onto the chat box, you're welcome to put it in the chat box. There's several of us monitoring that. But we may choose to wait to address it until the end, just depending on the question. And then at the end, you'll have the opportunity also to ask questions by unmuting yourself and asking yourself. So thank you, Sandra. And Amanda, we'll kick it to you.
Thank you to Sandra and all the wonderful colleagues that I have with the North Carolina Department of Public Health with the WIC program. So it's an honor to be introduced by somebody that's worked there. My name is Amanda Martin, and I have a Master's of Science in Public Health from the UAB School of Public Health, and I am currently the Bureau Director for for Family Health Services, which is within the Alabama Department of Public Health. I just had a quick agenda, which includes an introduction, which I briefly gave. I'm going to talk a little bit about the Department of Public Health and what we do, my career journey, positions that we have available, my duties, and then positions that are available with the Department of Public Health, which is I've labeled ADPH, and you'll hear me. I'm government. Been government for almost 25 years, so I do throw out some acronyms. I apologize. Put it in the chat if I need to explain it. And I'm hoping to meet some of you in person Thursday when we have Public Health 101 Day here in, it's going to be in Prattville, but it's being hosted by the Department of Public Health. As I mentioned, I'm a long-term employee with the department. I've been with the department since 2001, and the bulk of my career has been working with the maternal and child health population. The Department of Public Health itself, our mission is to promote, protect, and improve Alabama's health. Our vision is healthy people, healthy communities, healthy Alabama, and our core values are focused on excellence, integrity, innovation, and community. This is an org chart for the department. I realize when I blew it up, it is a little bit blurry, but did just want to mention a few things. We my supervisor is our state health officer, which is Dr. Scott Harris. He's actually governed by the state Board of Health. So we're unique compared to a lot of state agencies in that our person over the department is not appointed by the governor. It is actually somebody that comes within the Board of Health and is part of the medical community. As far as Dr. Harris's cabinet, he has coming over from left to right, Chief Administrative Officer. So a lot of financial and billing programs are under the Chief or the administrative officer, I'm sorry, we have our chief of staff, we have our chief legal officer, our chief medical officer, and that's my immediate chain of command. So the Bureau of Family Health Services falls under the chief medical officer. We have a human resources department, field operations, and then governmental affairs, and goodness gracious, the newest one I think is external affairs, legislative and external affairs. Sorry, he's fairly new and I forget that title sometimes. As I've already stated, I have a long career in public health. So I graduated in 2000. I actually learned about the School of Public Health while I was still at Auburn University. My undergraduate degree is in engineering, and I was going to stick with engineering and get my master's. And some of my professors pulled me to the side and said, listen, there's this great industrial hygiene program at UAB, and we think you've got some aptitude for it. And oh, by the way, there's some scholarship opportunities. And so I'd had the privilege of my parents working hard to send me to undergraduate without having to pay a lot of bills, but they were very clear. They wanted me to go to graduate school, but I needed to find some money to do so. So I said, sure, I'll go up there and I'll talk and see, what it's all about, and I'll apply and, just kind of see what happens. And so pretty much back to back, I was accepted into a master's program in civil engineering at Auburn, and then into the MSPH program at UAB. And UAB offered a full ride, so here we go. So I didn't, unlike Sandra, I didn't come in saying I was going to be public health. I really just came in saying, this keeps me in environmental health. They're paying for my, master's degree, and let's see where this goes. I did end up going back to Auburn after graduating, and completed a research project that I had started while I was there, and waited. As Sandra mentioned, it does take quite a while to get on with the government. Our days that do move slow, as she mentioned, but it was a worthwhile process, and probably very similar timeline to what Sandra mentioned as far as applying in the winter. And back when I was on, this was quarters, and so and not getting a job offer until much later in the year. I did start out as a public health educator, which is a position I'm going to mention in a few minutes. And over my career, have been able to work up to the Bureau Administrator level. It's a hard position to explain. In some days, I feel like I'm maybe more of an orchestrator than anything else, but it is rewarding. And I enjoy all the programs that I work with, and the ability to work in multiple areas and not be honed in on one thing every day. Over my career since 2001, I've worked in injury prevention, I've worked in cardiovascular health, rural health, WIC, which is the Women, Infants, and Children's Program, and I'm still working with WIC, as well as family planning, oral health, perinatal health, child and adolescent health, and cancer detection and prevention are all programs that are under me now. Also, like Sandra mentioned, my days are never the same. There's no specific order. I just kind of, as I was putting this presentation together, was like, here's a kind of a snippet of things that I'm involved with from day to day. Any one thing can take out a whole day or a whole week, especially depending on what's going on, sometimes with the federal government and sometimes with state government. I'm privileged that we get to do a lot around policy development with the maternal and child health population, and that's something I really enjoy. I have to do a lot of budget monitoring within the Bureau itself. I think our federal funding is just over $200 million. We do receive some state appropriations for some of our programs, and I think that totals to around $2 million. And then some of our work, especially through our case managers or our social workers, are what I call reimbursable income, because it's billed to insurance. And so we do have a little income there. But it's a lot of budget monitoring. There are 160 employees within the Bureau. So it's making sure we have everything we need, that we can pay salaries and benefits, and we're also working within the constraints of the grant. Lots and lots and lots and lots of personnel transactions. That one's is a great example of something that can go by quickly, or something that can consume your whole day, depending on what's going on. I get the benefit of doing a lot of mentoring, a lot with my managers, my direct managers, but also with new employees. We do in our bureau sit down with new employees and have about a 3-hour orientation just to working with public health, the benefits of state government, and things such as that. So we try to invest a lot of time in mentoring employees because we would like to keep them. Meetings, my least favorite thing, meetings. If someone had told me 15 years ago that I would be in more meetings than anything else, I would have laughed and run the other way. I think they are beneficial, but that's probably one of the my least favorite things. And maybe it's because I'm just not good at sitting. Collaborating with peers and stakeholders, that's been wonderful. We sometimes are small but mighty, and we've been able to do great things with the Department of Public Health just by collaborating with others, and working through our stakeholders to have a bigger reach. Grant writing, as Sandra mentioned, I do some grant writing. I do a lot of grant reviewing. And but I think that's great. That gives me the ability to learn more about what's going on as far as funding opportunities, but more, ability to learn more about the programs we have within the department. I do a lot of public education and advocacy, and sometimes those go hand in hand. We're gearing up for the legislative season, and so I already know some hot topic items that are going to be covered. One of the programs under us is teen pregnancy prevention, and that's one that continues to be on the radar of our legislature. So we're already working some education around the programs we do and some advocacy around the work that we do. As a state employee, I cannot lobby. No state employee can lobby. So all we can do is advocate and talk a lot about our programs and educate people around the programs themselves. And then we have regulatory oversight. Several of the programs that we administer within Family Health Services are part of state law. You all may have learned in class about notifiable disease rules or notifiable conditions, and several of those fall within the Bureau of Family Health Services. And then we have some such as the State Cancer Registry and the fluoridation state law, that there are some state laws that mandate certain things have to happen, such as reporting cancer detection and treatment within the state, and then reporting when water systems want to remove fluoridation. So some regulatory oversight there within the Bureau, and some monitoring. And so that's a high level. Again, I can't emphasize enough, if you like doing something different every day and you're not change averse, the maternal and child health field is wide open, and we do a lot of great things within that field. Family Health Services, just a quick snippet of our org chart. And again, I'll put in another plug. Some of you may get to meet me Thursday, and we'll talk a little bit more about this, but we do have 6 major divisions and then 2 offices. Our next speaker I'm going to get to introduce, I work closely with, is in the Office of Women's Health, and that's an office that is mandated by state law, and a great example of how we've done great things with our partners, because when that became state law, they told us, thou shalt have an Office of Women's Health. It's going to lie within the Department of Public Health. The state health officer determines who the director is, and we're not giving you any money. But we have done great things and have really expanded our reach and our partnerships in order to have a greater impact around women. Some of our programs at a high level, I've already mentioned WIC and family planning. We have the Cancer Registry I've mentioned. We have some newer programs such as maternal mortality review and the maternal autopsy program. We have the fetal infant mortality review. I've mentioned teen pregnancy. We have Healthy Childcare Alabama, where we go in and teach health and safety classes to daycare centers that are licensed by the Department of Human Resources. And we have our ABC program, which is a wonderful program for women that are not insured, that fall within a certain age range, can qualify for cancer screenings and then potentially treatment if cancer is detected. So we have a lot of great maternal and child health focused programs within the Bureau itself. Employment opportunities, and this is just specifically with Family Health Services. Some of them, let me say, are specifically with Family Health Services, but a handful are also generic to the department itself. Let's see, the Health Services Administrator, the Public Health Educator, Research Analyst, and Epidemiologist registers. you would qualify coming straight out of college with a degree, no experience required. And so these are often positions that we're talking to new graduates about. And I mentioned early on, I did start out as a public health educator, and I'm in the Health Services Administrator series now. We also, within the Bureau, hire nurses, social workers. We have nutritionists and registered dietitians, certified tumor registrars, an accountant, account technicians, and then administrative support. They make our world go round. So all of these positions we are usually throughout the year actively reviewing and recruiting for. I will say, I'll put in a strong plug for epidemiologists. We need more epidemiologists within the department itself. I wanted to share a few links, and Julie, I will be able to, I think you mentioned being able to email these out. I couldn't clean up and get some of my notes off of this right before we presented. So I'll send you a clean copy either tonight or first thing in the morning that you can share with the group. I wanted to share the link to Guide to Services. And so that's a great way, a great booklet to go in and look at on the web to see more about the Department of Public Health and what we do even beyond family health services. ADPH employment opportunities. So that's a website that we try to keep routinely updated that will show opportunities throughout the department. It also links to how to get into state classifications to get on what we call registers. And it's not the easiest thing in the world. It's not the hardest thing in the world. The big thing is to be patient. As Sandra mentioned, we hurry up and wait sometimes in government. So it's a process to get on registers. And you know, you'll persevere. Don't give up. But there is more information on that link about how to apply. We have our Alabama Health blog, and that's where they post maybe our recent social media releases, not public releases, but press releases. Sorry, lost the word for a second. Press releases of things that we're working on, but it's a great blog where you can go in and see what's going on within public health itself. And then the last thing, if you had any data nerds or wizards, I enjoy going to look at the Alabama Health dashboard. It started out as our COVID dashboard in 2020, but it's transitioned and it shows more information about our health rankings. A lot of things with maternal and child health are going to play into factors related to health and chronic diseases. And so it's an interesting dashboard to go and look at, and they do keep that routinely updated. So don't panic. I will make sure this information gets shared so you'll have access to those links. And I just wanted to say thank you for your time. I know I've said it a few times, but I do hope to be able to meet some of you all on Thursday and have a little bit more in-person time. I would say that even though I was industrial hygiene focused, which may be different from other panelists that you've had, I do think in the 2 years that I was at UAB, I got a really broad spectrum of access to what is going on in the public health arena. And honestly, my bachelor's in engineering, if it helped me with nothing else, it was with processes and government and business and being patient with things. So I would say that, you know, no road was a dead end. Don't limit yourself. Try not to say no. I had this thing in my head and I'd say, you know, unless they asked me to go play in traffic, I was going to try it. So, you know, don't say no. Be flexible, be extremely flexible. Maternal and child health is broad, and there's so much beyond your world of thinking and what you have access to. So just really being flexible, listening to others, listening to your inner self, but just come in knowing that every day there's something new and every day there's going to be change. Always seek new opportunities. Even as the Bureau Director, which I've been in this position for, I think, 4 years now, we're still seeking new opportunities. So I may be as high as I'll ever go with the health department, but I haven't given up on looking for those new opportunities for change and to make a difference out in the community. And if you need training and support, that's a big thing. I kind of see come and go with the workplace. Ask. It's like Sandra mentioned, don't wait too late to talk to HR. If you need that support and training, ask. I mean, that's what we're there for. And if you don't vocalize it, some people like me that have been in the workplace for a while, we don't know that you have that need. So don't wait till the end and you're walking out the door. Ask up front for the training and support that you need. So that's it for me. I'm going to introduce Honor, who's now Honor Hill. Congratulations. And my colleague in the maternal and child health world, Honor does a lot of wonderful things for us and supports us with public health.
Thank you so much. Yeah, I have the great pleasure and honor of working really closely with ADPH in different capacities and sitting on some of the groups that Amanda mentioned. And so I think it's great. I love hearing about the world of government, whether that be state or federal. It's very different than what my career has been. So I get to talk a little bit about the nonprofit world, as well as the community-based organization world. I've served in roles in both of those types of organizations, and I'll talk about the difference a little bit. I'm not going to share slides. I started to build them and I was like, I'm getting too specific. I'm getting too specific in like my work. And so I want to talk broadly about just kind of CBO and nonprofit world, CBO being community-based organization, because it's different. So wherever you go. So let me start off by saying I came into my undergraduate knowing I wanted to do maternal and child health. I was someone who in high school, I had heard Melinda Gates talk about how women and children are the window into a society's health. They aren't taken care of, the rest of the society is not either. And so the significance really hit me. I also had the opportunity to travel a lot when I was younger due to my mom's position. And so I had experienced many different cultures and many different countries. And I realized, oh my gosh, that's so true. I will say I changed, y'all. I changed so much. I was going to be international. I was going to be global health. I was going to focus really in countries that no one heard of. Like that was my focus, and that's such an amazing path. But things change, and things will change in your jobs. And I ended up getting very pulled into research at a young age in undergrad. So speaking to those who are in your undergraduate degree, it is not too early to seek out maternal and child health information, experience, take that opportunity. I had the opportunity to do research, and as an undergrad, specifically in the maternal child health world, and I took it. And that was the deep dive into, oh my gosh, I like stateside work. And so I really started focusing in on adverse childhood experiences, which are experiences that kind of affect someone's, they're linked to a whole bunch of things, their health, their mental state, their opportunities. So those adverse childhood experiences is a parent incarcerated? Was there violence in the home? Was there divorce in the home? All of those are they started off with 10 adverse childhood experiences, and have grown. So I started young on that, and I encourage undergrad, you can do MCH now. You don't have to wait till your master's. You don't have to wait till you're out of school. Search out and ask. I also had the same experience in grad school. I went and I asked, hey, is there any research that I can help with in the maternal child health world? I also graduated and I went into the AmeriCorp. So that's also part of my journey. And I'm going to put the link here. So the AmeriCorp is like the Peace Corps. If y'all know and heard of the Peace Corps, it's unlike the Peace Corps, it is a 1 year experience. You can sign on for 2 if you want, but it's a 1 year experience that you sign up for, and it's serving underserved areas. And so it's like the Peace Corps in the fact that you are really almost like a missionary sent into the field to do programming and works. And this was so transformative, and they have since then have started a specific public health AmeriCorp. If you are in public health and like that, I went through AmeriCorp state and national. That is a specific part of the AmeriCorp experience. And really, it's all about serving your country. it might seem like, oh, that's so weird. I've never really heard of that. Y'all, older individuals have heard of it. If you want something that looks great on your resume, AmeriCorp, and it's a 1-year gap experience. And I had the opportunity to do it here in Birmingham. And that's what got me attached to the state of Alabama. I was doing vision screenings in preschools. I was setting up, making sure I was taking, I was the coordinator for all these vision screenings throughout the entire state of Alabama, in preschools, and working with other like-minded individuals who were focused on service and focusing on serving their country and serving their area. And I think that service is really what helped steward me into a nonprofit and community-based organization. I ended up staying with the nonprofit that I was in the AmeriCorp with after my AmeriCorp service, and just became a staff member. And so that's where my community-based organization background has come. If y'all are unfamiliar with community-based organizations, those are going to be organizations that are very specified to an area. So they are focused on the Black Belt. They're focused on Birmingham. They're focused on Alabama. They're going to get very specific, and they're not going to have really a national focus. It's hard to be community-based when you're nationally focused. They are also very much going to be focused on programming. They could be direct services. Most of the time they are direct services. And then I stayed there, continuing to work as staff, working on things like taxes and making sure lower income families got appropriate tax services, aren't preyed upon for predatory tax services. So I kept doing that before I moved on to March of Dimes, which is where I am now. And that is a national organization that focuses on maternal and child health. And so we have a focus on prematurity. And as I said, I started to create slides, y'all, and then I just started to go specifically into March of Dimes. But I think that that starts to, I'm like, okay, that starts to get really specific into the mission of March of Dimes. But as Amanda said, there's so many different facets within maternal and child health that I think March of Dimes does an amazing job in prematurity research and maternity care deserts. And we have our specific focuses that we focus on, and making sure that we're preventing prematurity. But you have incredible organizations and community-based organizations, national organizations that focus specifically on maternal mental health, that focus on preeclampsia, that focus on diabetes, you just go specifically into these niches. And so one thing that's amazing about both, I'm going to pull back and talk about nonprofits and community-based organizations. One thing that's amazing about both of them is that they are more flexible in the governmental affairs section. So as Amanda mentioned, most state and national entities, that if you're a part of that, you have strict guidelines on what you can and can't be involved in on an advocacy level. I have the pleasure, I'm going to say it's a pleasure, to be the governmental affairs director for March of Dimes in the state of Alabama. It's something that I'm very much involved in, and policy has become something that I am very passionate about. Again, as I said, you change, y'all. I never thought in a million years I would be in policy. I never thought in a million years I would be lobbying or advocating or writing legislation. Things change. You evolve, especially in the nonprofit world and in the community-based organization world. You're going to wear multiple hats, whether you want to or not. You're going to wear, you might wear your program. You might have a programmatic hat on. You might have a fundraiser hat on. One thing that's true about pretty much all nonprofits, you are never too specified in what your area of maternal child health that they aren't going to ask you to raise money. So be prepared to write grants, to ask people for money, to say, hey, you know what would be great if you upped your giving from X to Y. And you get used to that, and because you know where that money is going, it hopefully you have a good nonprofit or CBO that you work for, that you feel confident in their mission and the work that they're doing, that you can feel comfortable doing that. And most places teach you, again, also ask if you need need guidance. But so you're gonna wear your programmatic hat. You're gonna wear your fundraiser hat. You might wear a governmental affairs hat. But this is really an area where you kind of get to break out of the box and do things that you might not be able to do in other sectors. So just you don't have those limitations that are put on certain funding and certain entities. However, you do become a little bit handicapped in the fact of what funding you are getting. So if you're applying for a grant, you have to do what this grant you said you're going to do in that grant. And so a lot of your role becomes fulfilling grant requirements, fulfilling what you have put down in a grant. For CBOs specifically, you're going to be programmatic specific. I wrote a grant that said that we were going to give blood pressure cuffs out to families. My job as you know, an MCH person in this CBO is fulfilling that grant that I said that I was going to do and tracking and evaluating how that's done. It might be that in a nonprofit, might be an area of focus, but you have some grant backers. So you're not directly over the grant, but you're still trying to fulfill those grant requirements. And just be prepared in the nonprofit and CBO world to care about evaluation. You have to be able to prove what you did, that it's going well, to come up against, you're going to come up as our governmental and federal, like state and federal partners move, you're coming up right against them to work together to do something. So what are you doing? How is that helping? How are you filling gaps? What are the specific areas that you're focusing on? You're going to have to answer all these questions. So I think a lot of the takeaways from being in a nonprofit, it's very rewarding. It's very rewarding, but you're going to be pushed out of your comfort zone. You're going to do more than just your little box of things. You're going to end up being y'all, I work for a national organization and I still do the social media, which I did when I was the MCH SA president. So you have these roles that you get put in that you're going to have to be flexible about and be like, yep, I do it all. I do the programmatic stuff, but I also help get volunteers. I help with our advocacy plan. I help raise money. So you just keep putting on all these hats and creating boundaries. Well, as you do that, yes, I'm happy to do that, but I'll only give you an hour a week on this topic. Yes, I'm happy to do that. It's part of my job. It's in my job description. But you said that it would only be 25% of my job, and that is this many hours. So creating boundaries as you do things. Because I think in the nonprofit world, you end up with a lot of hats. And really feeling comfortable with the fact that it's going to be really grant focused, it's going to be money focused. And thinking through, okay, what money do we have? What have we said that we're going to be able to do with that money, and following through with that. So I think that that's all from my point of view. Happy to answer any questions about the nonprofit world, about governmental affairs, about community-based organizations. I will say, luckily in my world, it's not just public health people. It's people with public affairs backgrounds, it's nurses. The same people who are in my position all over the United States have extremely different backgrounds than me. Only a handful of us have public health backgrounds. My West Texas counterpart is a nurse, was a labor and delivery nurse. My partner in Pennsylvania is a mental health specialist, and she has her degree in mental health. So it really just is a very broad amount of people who are in the nonprofit world, which brings a lot of interesting ideas and concepts. I'm going to pass it over to Camila to talk a little bit about her role at UAB.
Hi, everybody. My name is Camila Robinson. My official title is Office Associate 2 at UAB in the Department of Obstetrics and Gynecology in the Division of Maternal Fetal Medicine. So my career journey at the beginning. Like I'm very much at the beginning of my career. My interest in maternal and child health began with my experiences having children and the discrimination I faced as a young Black girl, having kids and being told that this was happening because, you know, you're a young Black girl having kids. So that's when I became interested in maternal and child health. It just so happened to work out that I ended up working in maternal and child health. I'm still pursuing my undergrad degree, and I have 2 more semesters to go before I'm even finished with that. So definitely not in a master's program yet, or, you know, anything like where I'm super professional and on the path to where I'm going to end up being. But for right now, my role is an administrative assistant, and there are a lot of different names for that role. UAB calls it an office associate, an administrative associate, an executive assistant, an administrative assistant. So anything that sounds like that. And there are tasks that are universal to an administrative assistant role, such as scheduling meetings, keeping calendars, meaning making sure on a day-to-day basis that the executive that you take care of's calendar looks okay, there aren't any conflicts. And what that means is 2 meetings scheduled at the same time, or meetings being scheduled while they're at a conference or traveling and literally on a plane and not available to take the meeting. Tasks also include booking travel and building travel itineraries, like paying for flights, reserving hotel rooms, and making sure that the flight that they get on gets them wherever they need to be in time to make whatever arrangements that they have there that they need to be there for. Also updating and managing their CVs, making sure that everything that they do professionally and academically is being reflected on their CV, any accomplishments that they made, rewards that they've been given, honors and things like that. All of that, just tracking that and making sure that as they're, you know, doing all these amazing things, you're reflecting that on their CV. And essentially making their life as easy as possible, making them in their busy state not have to worry about all of the little things. That's essentially the role of an administrative assistant. What I always tell people is that role is very tailored to the executive that you take care of. 2 administrative assistants can gain experience in 2 completely different areas, have the same job, and not know how to do anything that each other do. And what that means for me, my executives are research-based. They're physician scientists. They are investigators on these huge projects, and they're the ones winning these grants and getting all of this funding for all of these projects. So my experience and the skills that I've built are research-based or around research. So that includes drafting letters of recommendation, drafting letters of support, and supporting documentation that goes with a grant proposal, building slide decks and PowerPoint presentations for when they travel to present on the research that they found and, you know, what they've discovered from the research that they're doing, drafting talks for seminars and scripts and things like that. So when they do give their talk, they have their script to follow so they don't veer or go past the time that they've been allotted. Building editorial managers for manuscript submissions, making sure that the manuscripts that we have follow the author list that's listed, follow the journal guidelines, and as far as word count, format, any supplemental materials like tables or figures or anything have to follow a certain format. So I manage and make sure all of that is correct. Also, I draft, collect, arrange most supporting documentation that goes with grant submissions, such as bio sketches, facilities and resources, letters of support, and things like that. So like when Amanda was talking about the grants that she reviews, I work with the grants that she's reviewing to make sure that the proposal is exactly how they said it needed to be when they did that. I think they call it funding opportunity announcement. Another thing that I do is I plan events and coordinate the events. That's for any large meetings that they have to get together and discuss the projects, update each other on the projects. That means booking the space, arranging for refreshments or food, paying for everybody to get there, making sure that they are set up at UAB to be reimbursed for any travel expenses, tracking the expenses, and using the UAB card that's been designated for this, and then submitting all of the invoices and reimbursements and all the things on the financial end to make sure that everything works out and everybody gets paid what they need to be paid for the whole thing to work and get pulled off. We also have faculty that come from all over the world. For example, we have Jim Kim coming. He's the president of the World Bank, and he's coming here in a couple weeks to give a talk. And I've been heavily involved in arranging all of that and coordinating all of that. And then on the financial side, I'm a lot of finances, paying invoices for vendors, managing contracts that we work with in our projects, acting as proxy on institutional cards at UAB is called a P card, keeping up with accounts to make sure that we're well within the budget and that we do have the budget for this on the grant so that we could do what we need to do or travel where we need to travel or, you know, pay for this thing. It says it on the budget. It fits within the budget that we can do this. I keep up with that. And then every fiscal year, the account numbers change. So I have to track all of that. So it's a lot. And the great thing about this job is it's a very good job to build experience. It's a very good job to build a lot of skills that you would have never gotten anywhere else. And it's a great opportunity to set the foundation or let people know where you want to go. And so what I've done, I'll speak for myself personally. I'm a bulldog. I'm gonna get it. Like, I'm gonna go for whatever I need to go for. I know that I plan to get my master's in biostatistics. I know that I'm certified in all of these coding languages. I know that I have data analytical skills. I know that I'm headed this way. So when I got in this position, I met the chair of biostatistics. I said, hey, I'm me, meet me. This is where I want to go. This is what I want to do. Do you have any advice for me? I met with the director of the data center in our Center for Women's Reproductive Health. I met with the database manager. I took advantage of my connection to my executive and made meetings with all of these people to set a foundation for this is where I want to go. And I think that it would be valuable for me to, you know, partner with you to see it, to work on the projects that you're doing to gain a little bit more experience in, specifically to me, data analytics, biostatistics, statistical analyses, and things like that. And I went to Dr. Tita, who is my executive, and I said, hey, I know that I'm an administrative assistant and I'm supposed to, you know, be keeping calendars and scheduling meetings and all of that, but I want to be more involved in research. And I see you're on all of these projects and I want to join the meetings. I want to just sit quietly in the background to hear the conversations and hear what's going on here. I want to know what you guys are talking about. I want to know how these decisions are being made and the back and forth and the give and take. I want to know all of that. So it's a really good role to connect with people and make sure that when you do graduate, or if you're graduated already, you can move into the role that you want to be, or a role that can lead to the role you want to be. Because I don't know if this is the same for everywhere in the US, but in Birmingham, getting the job you want is who you know. If you're connected to somebody in an organization that you want to work in or a field that you want to work in and they can recommend you, that's how I've gotten every job. And especially this job, I was recommended for this job. And she reached out to me. She called me on my cell phone and she said, hey, where do you work right now? Do you want to do this? And I said, yeah. And we did an interview and I was hired. So this role, it gives you the space. It's not too busy. So you have the freedom to move and set your plan and connect with people and meet like really important people, the people who would be making the decision in hiring you. They see how you work, they see that you do a good job. And so there, if you have the skills and they give you little projects to test to see if you are about what you say you're about, they give you these opportunities to prove what you say. As long as you prove yourself, they want to work with you. So that's how I've taken advantage of my position. And I think it's just been really valuable to me. It's an entry-level position. You can get it while you're in college. You don't have to have a degree. You don't have to be in a master's program or anything like that. And there are so many organizations and institutions that need administrative assistance. Everybody needs it. There's an administrative aspect to everything. Even like blue collar jobs, there are administrative roles in those companies that need to be filled. There's an administrative process to everything, and everybody needs administrative assistance. Right now on campus at UAB, there's so many admin roles posted, office associates, administrative associates that they're hiring for. And I think it would be valuable to take advantage of your advisors, take advantage of the people that you know, like professors and people that are in your classes, to see if you could get connected and if they need anybody in an admin role, if that's something that you're interested in, because it's difficult getting hired at UAB if you don't have any connections at UAB. And those admin roles are really easy to get. It's if they know you, if they have a feel for you and they feel comfortable, you know, somebody said, this lady's great, this guy's great. It's a really easy role to get from there, and it's a role for growth. You can grow so well. As long as you have a supportive team, they will let you grow and they will support you. And it's not too busy or too technical that you can't split your focus and do your job and do it well while also making connections to go somewhere better that's more catered to what you want to do. For maternal and child health specifically, there are many roles, and it's not just obstetrics and gynecology. You can get in this role in the biostatistics department. They don't need just biostatisticians. They need administrative assistants as well, in epidemiology, in the Institute for Human Rights, in a lot of places, anesthesiology. I'm just thinking about all of the people that I have to email every day and what departments at UAB they work in. So it's widely needed, and it's always something that they're hiring for. There are always roles posted on the UAB careers jobs page. And yeah, that's been my experience. Like I said, very entry level. I don't have like a huge career journey to share, but I've been able to grow a lot in this role, and I don't think I would have ever been able to access the people that I have access to if not for this role and the people that I've worked for. And I've had a lot of fun, and I've had a great time learning about grants. I've had a great time learning about research and the process. I've had a great time watching projects start, you know, go in the middle and, you know, go get to the end. Like specifically right now, they paid for me to come to Texas for the AHA strategic network meeting. And I get to be in the room with all of these people that are making all of these decisions. I get to be in the room with people who are here to present updates on their projects, to talk about enrollment, to talk about patient recruitment, to talk about barriers that they faced, and with institutions and all of these red tape and problems that they have trying to get around state law and federal law and institutional law. And just the access that I have, I never would have known that these are the kinds of conversations that are happening in the background. And this is what they're challenging them to do. And this is how they grow. And this is how a project is taken from point A to point Z. So yeah, that's my experience. It's been amazing. I love my job. If you can't tell, I will be going to something more, you know, down the road. But for right now, I'm having a great time and taking advantage of the people that I have access to. So that's me, and I will pass it to Jalor now. Thank you guys. It was great to talk to everybody and present here on this panel. Go ahead, Jalor.
Thank you, Camila. And thank you, Julie, and the leadership of MCHA for having me here today. So let me start by, telling all of you or sharing with all of you what I do right now. I'm working as a statistician in the Department of Health Policy and Organization. As a statistician, again, for the last 3 years. And I taught statistics for about 5 years, including or mostly people without any stat background, managers and C-suite level execs and all those stuff. Currently, I also teach a master's level online regression analysis class, HPO 687. I also TA the doctoral version of it, HPO 787. Our department, if you do not know, have access to a lot of health insurance claims data, predominantly all kids, which is our children health insurance program. So we have claims data for all kids and Medicaid. And I also work with analyzing all kids and the Alabama Medicaid data. So again, all of us know, I mean, if you want to be a data analyst or statistician, there is no better time to be one, right? Because huge amount of data being generated, right? Every visit to a healthcare facility or a healthcare provider generates data. Then there are clinical trials, a lot of them at UAB and in different institutions around us. There are surveys, there are interviews, there are focus group, and so we are getting a lot of data, and these data are being used to drive evidence-based policy making. And you need data for evaluating programs to understand what works and what does not, right? We need data to understand, monitor the trends. For example, maternal mortality rate, infant health outcomes, preterm births, anything that you can think of. We also need data to contribute to designing an intervention for a specific targeted or vulnerable populations, for example. And then the next would be to what, as a data analyst in MCH, what are you expected to do? It won't be vastly different than any other field. Probably, again, every field have some specific things that you have to take care of. For example, in any data analyst role, you might be required to collect data and manage those data. So collecting data for MCH can be, data for birth registry, hospital record, public health, different surveys, and understand that when we talk about data analysis, it's not only about quantitative data, it's about qualitative data as well. And vast majority of the time as an analyst, you'll probably spend cleaning the data. If you're working with claims data or any other large data set, cleaning and preparing data takes probably 70 to 80% of the time. Then there is, you will be asked to analyze the data. And analyze it can mean, some descriptive statistics to running sophisticated statistical methods to study, different health outcomes or different identify risk factors or evaluate an intervention. So it can be, again, depending on a project, it will vary, but those can be a different kind of analysis that you can undertake as a data analyst. Then finally, there's also, visualization piece of it that you might be asked to, as a data viz analyst, you might be asked to create dashboard, different visualization charts and figures or reports for public health agency, for policymakers or any other researchers that you are working with. And also the new thing is the emerging tech with big data and machine learning. You may be asked to use predictive modeling and AI to identify, vulnerable populations, so those are the things that are emerging with, machine learning and big data. Then there is health informatics as well, so that you can use. What are some of the skills that you may require? So in terms of technical skills, probably proficiency in any statistical software if you want to be a quantitative data analysis. So some softwares that we use in our departments, SAS, Stata, R, Python. I mean, if you know any of them, that should be a good starting point. And then for data managing and cleaning, you will be using these data sets. Once you learn a software, the next big thing is to kind of learn how to clean and manage these data sets, the big data sets, using these software packages. So I'll share in the chat a few publicly available data sets. Whether you are an undergrad student or grad students, there are just so many publicly available data sets that you can use, even on your own, to learn about these different, data, how to analyze these data, big data sets, especially, working with, cleaning data sets, how to handle missing values, how to, read the data dictionary and then go back and analyze the data. So it's very important to understand those different pieces that requires you to, or gives you a big picture understanding of analyzing a data. Then the other thing that might surprise you is that you also need some soft skill as a data analyst, because in the world of public health, or MCH in particular here, we'll have to be good in communication as well, because translating the data insights into for non-technical audience, that's what we mostly do, requires communication skills. And you'll also need to be good working with interdisciplinary teams, because in the field of public health and MCH, we work with clinicians, we work with social workers, policy experts, and administrator, a lot of different type of people. Even in department, there will be faculties from various departments and various disciplines. So collaboration and understanding the fact that you need to collaborate with multiple stakeholders is key. And then finally, critical thinking is a skill that requires, in most jobs, and will get you very, very far into any kind of job that you take in. Finally, a few action plan. So what can I do if I want to be a statistician or data analyst? You can take classes. There are a lot of online classes. There are classes, you don't necessarily have to take classes in the UAB department. There are a lot of YouTube videos and training materials that you can watch. That can be a good starting point to see whether you are interested in being a data analyst or data visualization expert. Or you can also sign up for some classes at different departments at UAB. Then next would be to learn different software packages. The third thing that I would emphasize, or which I think is one of the most important thing that will take you very far, is that working with faculty members, especially junior faculty members such as assistant professors, who may have a lot of different projects and applying for many grants, and they need help. And as an undergrad or grad student, if you reach out to a lot of these faculties, again, our department has 40 plus faculty members, I believe, and if you reach out to a lot of these faculties, I'm sure you'll hear from at least one or two that they may need some help. What they require is that you do not necessarily have to have all the skills to analyze data. What they want from you is probably that I may not know the answer, but I know how to find the answers, and I'm committed to finding the answers and help you out. So that commitment, can make you a very attractable candidate for a faculty to work with. Then the next is get involved with professional association and student orgs such as this one. Network with alumni. There are a lot of network with alumni events that different offices and student orgs in the School of Public Health organizes. Try to attend them. Attend career fairs, whether it's organized by UAB School of Public Health or UAB Career Service Office. Any organizations that are organizing career fairs. Even if you are, let's say, looking for a job 2 years down the line or a year down the line, start exploring now, so that you know what is expected of you, once you are in the job market. And finally, I would say, if needed, go ahead and pursue additional certifications, whether undergraduate certifications or graduate certifications in statistics, in mixed methods research. In our department, we have mixed method research certification. We have, at the UAB, we have statistical and behavioral health certification. We have statisticians. I think there's a certification on biostat. There is a certification in AI in medicine. So there are just a lot of different certifications that you can pursue if you think that's something that you want to do. That's all I had. I know we are short on time, 6:48 already. We probably have about 12 minutes. I would be more than happy to add, sorry, I would be more than happy to answer any questions that you may have.
Thank you to all of our panelists. And also, this is an opportunity for our participants to pose questions. You're welcome to unmute yourself and ask your question. If you're not comfortable with that, you're welcome to put it in the chat box, and several of us will be monitoring that. And then, of course, those who used slides that have given us permission to share their slides, we'll be sharing those in a future email. We'll also be sharing some of the information that our panelists put in the chat box. So what are your questions?
I am currently working at the health department in Tennessee as a community engagement coordinator, and I'm getting my MPH in health policy and leadership. And so I'm looking to transition into a role that's either dealing with policy or a more, I guess, mid-level role, because I've been in my role for about 2 years. I'm looking to maybe do less community engagement and more like policy or programming, like implementation type roles. So I was just wondering if you had any advice or tips and tricks for trying to like navigate finding a new role in public health. And I guess this can go for anyone, and it could be either government or private or nonprofit.
I know in the presentation I said apply, but there are quite a few policy analysts that we have, at least with HRSA, because of the programming that we do, that we use to support through grant funding. It's driven by the legislation. So a lot of times when the legislation changes or when we want to know the intent of the legislation, our policy analysts are those people that we rely on. And they also keep us keep us in line. I don't think there's anything wrong, and this is just me. I don't think there's anything wrong with internships or shadowing or things like that, because it does gain you some experience. So it may not be the big full out position, but I think still getting the experience, I would say you never know. I think Honor was saying like she changed. And I'm like, yes, it does that to you. You go in with one mindset, only to find yourself somewhere completely different, but also fully fulfilled in what you do. So I would say apply, see if there are mentors who could possibly provide some experiences for you. And closed mouths don't get fed. So, to Camila's point about just kind of going after it, you never know. You never know.
We did have a question in the chat box. It's sort of a double question. One is, are there some common misconceptions that you all get when it comes to working in the health department or, the public health world? And then also, what are some practical skills that you recommend building on to get a job in a health department or spaces within public health? And I know one common misconception is that if you work for the Alabama Department of Public Health, you actually provide clinical health care in a health department. And there's so much more than that.
Sure.
But I'll kick it back to you guys.
I can definitely answer the very specific question about the post-obs, and I'm sorry, my fur babies are going nuts because my child's getting in from baseball. So post-obs, we at the Alabama Department of Public Health provide a plethora of contraceptives for men and women. Now with men, we're talking condoms, but with women, we do all the way, pills, diaphragm, all the way up to Nexplanon, which is an implant. All of our nurse practitioners at the health department are trained to put in implants and IUDs and to remove those. And so our supply cost doubled in May of what would that be, May of 2022 now, when that all changed. So common misconceptions are that you can come to the health department for an abortion, and that's not true. We saw a little bit of an uprising from some groups that maybe there were increases in the use of Plan B. And so that is an alternative form that we can provide, which it does not abort a fetus if it's implanted, but it can help prevent implantation. So just a lot of misconceptions. The program or the federal funding that we receive for family planning is federal funding, and so there's some requirements with that. When Alabama became a state that no longer allowed abortions, it didn't change how we did things, and that we still cannot provide abortion counseling at the county health department. So sometimes that's a little bit of a misnomer too. We can refer out, we can advise patients about a national hotline where they're able to gain more information about abortions and pregnancy resources. And then we have a network of pregnancy centers throughout the state. So lots of misconceptions. And this question comes up fairly often when I speak. So that must be something you all talk about a lot politically at UAB and some of the classes. The second question was, what was it? Tips about public health. I'm sorry, I did something to my screen and I lost the chat.
Practical skills that you all recommend building on to get a job in the health department or spaces within the public health world.
Sure. So to play on what Sandra mentioned, patience and apply. But practical skills, you're getting a lot of those. I think with public health, you're getting a broad spectrum of access to things. So, build upon, again, I mentioned, don't be afraid to ask when you need more assistance and technical assistance. But skills in general, I think, especially for our entry-level positions at the Department of Public Health, you're going to have, just by your degree, you're going to have some of those skills.
And I would add, there's a high percentage of MCHSA members that are not public health students. There are a high percentage of participants today that aren't public health students. But still, some of those skills like honing your verbal skills, like Jalur said, working on an interdisciplinary team, talking, honing your writing skills. It's hard for me to imagine that somebody nowadays can't work their way, pretty cleverly around a computer keyboard. But my goodness, if you have trouble with keyboarding skills, working on those kinds of things. Jalur, I know, presented a lot of specific information about some practical building blocks if you wanted to get into data analysis, data visualization. Do some of you also have some other practical tips that people could work on if they want to end up in the fields that you represent?
I put a book recommendation in the chat about practical skills. Specifically, resource management. I'm sure everyone in any, not just public health, any MCH realm, you're gonna have to be able to do resource management and allocation of resources, decision making, specifically data decision making, change management, systems thinking, strategic thinking. That's just some of the skills that this book talks about, that they came out late last year. But yeah, I will say that there's a lot of they're called soft skills that are transferable to other places, and put them on your resume. If you have studied systems thinking, if you have studied resource management, if you have studied community engagement, if you've studied conflict resolution, put them on your resume, because that comes in everywhere you work. And especially in the MCH world, where we're constantly fighting the good fight for moms and babies. And that includes working with a lot of different people, working with a lot of different partners. And I'll say that kind of comes in with the post-ops thing. Y'all, there's still work to be done. There's still things that are on our list that we got to get done, whether or not we're in post-ops world. There is items that there are items that got to be done. There are high rates of things we've got to make sure that we're listening to. There will always be families who we want to help prevent an unintended pregnancy, make sure that they are in good economic standing, make sure we break generational curses. All of these things are going to always be there for us to just continue to take down. So get those skills that help you do that. regardless of the political temperature, regardless of what policies passed, you're going to have to continue to do the work.
And I think Camila made a good point when she was talking about who you know and what the people that you interact with think about you and the quality of your work and how easy you are to work with.
That's what I was
doesn't
gonna
start
say.
after
Yeah.
school, you know?
Yeah.
That's like how you are in your current job as a student or how you are as a student within the classroom. You're creating a network right there that could shoot you in the foot or could open some doors for you.
And I was gonna say, when I started working in this kind of environment, a skill I already had was email etiquette and, you know, how you respond over email. There are certain tones that can come across you don't mean, but that's how it sounds. And in my role, I have dealt with some very difficult personalities. I've dealt with people who don't understand the administrative process in any way and don't understand how many steps go into, you know, one process, and that expect these ridiculous deadlines and just things that I've encountered. And as somebody who is young with a hot temper, I have had to take a step all the way back and just breathe, you know. And I think for me, specifically practical skills that you don't learn in school is email etiquette, keeping your emotions out of email, respond as professionally and emptily as possible. They can't look at this email and pull any emotion at all. Read it 30 million times, send it to somebody that's unbiased and separated from the situation before you respond. In real time, when they come to you face to face, if you feel like you're gonna react negatively or respond in a way that could damage your reputation, say, hey, I need to step away. Can we meet about this later? Don't respond. Don't give them anything. And another thing is problem solving in the most minimal way, like in the smallest task. Somebody could be so overwhelmed and so busy that they freak out because their computer screen froze, you know, and I'm talking full-blown 2-year-old temper tantrum freak out. So being able to hear the problem and not feed into the energy, but just take a step back and say, hey, it's going to be okay. You know, no matter what, this is going to work out. Like, we're going to get it done. And being that person who's always level, doesn't respond to the freak out, doesn't respond to the pressure. You're going to run into a lot of people who have so much on them. Responsibilities are stacked high above their head. They need to be in 30 different places at one time. Their problem, their emergency is your problem, your emergency. And being able to not get affected and keep your tone even, keep your attitude even and clear, and say, hey, it's going to be okay. We're going to get this done. I know it seems like it's not going to work out right now, but we're going to get this done. And then get it done. You know, that's something that I did not get in school. That's something that I did not learn. And when I first started working here and I started working with these people, it was like the first time I ever did it, where I was like, it's gonna be okay. Like, we're gonna get it done. He stopped and he looked at me. He was like, yeah, you're right. You're right. We're gonna get it done. And he just walked past me and went into his office. I think that's very valuable across the board in all disciplines. So that's my little 2 cents. I do
Just
have
add,
to run, you guys. I have to hop off. I'm really sorry, but it was great talking with everybody, and thank you for the opportunity to speak with you guys. Everybody have a good evening.
Bye, Camila. What were you saying,
just
Jacob?
add, just adding to Camila, you know, speaking of email etiquette, you know, reply all feature, be very careful of that, right? I mean, and then also know that there is an email schedule button now. You can, you know, you don't have to email someone at 10:30. You can email them at 8 o'clock in the morning or 8:15, or whenever that you want the email to be read. So know those things. And again, I agree with what Honor, Camila, and Julie said, but all I would again go back to is that remember hard skills or any software skills or anything for any role, even if you're not a statistician, that are probably easy to get. You can watch some videos to learn how to use a software, how to do some analysis in Stata or any other softwares. But soft skills that Honor mentioned, those are really, really difficult to build. Understand that it will take time, and that's okay. And how do you improve it? You just have to have a plan. Again, that's why you get involved with student organization. You work with the faculty. Whenever you are involved in a student organization, you learn how to resolve conflict. Honor talked about conflict resolution. You'll see different conflict, managing time, resource management. You learn a lot of these things whenever you get into any volunteer role or any, part-time paid role, anything that you can get. Just get involved. If someone or a faculty that you have some similar interest to work with, do not have any student assistant position or they're not hiring a research assistant, just tell them that I want to just join your meeting to see, as Camila said, just be an observer to learn, and that will take you a far, far way in terms of building these soft skills that everyone is talking about. Because, when I started analyzing data 16, 17 years ago, I used to predominantly use eViews. That software no longer exists. Probably none of you have heard about that software. I quickly transferred to, Stata. When I started on this role 3 years ago, I was familiar with SAS, but now I predominantly have to work with SAS because of the Medicaid claims data. And these are some of the softwares. Once you know one software, you can, if you have interest in it, you can learn any other software very fast. But soft skills, it will take some time. And those are the skills that will, take you very, very far. And that's why it's important to get involved, to be an intern, get into internship, work with faculty, attend career fairs, talk to people, ask questions, or network with the recruiters, network with alums, so network with anyone that you meet, faculties, your fellow colleagues. You never know who will be valuable resource to you down the line.
Totally agree with all of that, Jalur, and I think it helps to be a learner and to always be a self-evaluator and to ask for coaching and mentoring. I mean, it may not be formal, but ask for feedback and be willing to receive it. I want to thank everybody for participating in tonight's panel presentation. If you had a question that you didn't get a chance to ask, just email it to me. I will make sure that the appropriate person gets that question and gets it answered. And then I'll include, like I said, the information in the chat box and the slides that we've been given permission to share. I'll include those in a future email. And I just want to thank you for taking your time with us this afternoon. Thank you to our panelists for taking your time to present and to prepare. And I hope you all have a wonderful rest of the evening.